This screencast is about psychological assessment. Assessment is an interesting part of clinical psychology that a lot of students don't realize that psychologists do. A lot of times students think that psychologists just do therapy. I myself don't do any therapy clinically, and I only do assessment. Frankly, I really enjoy doing assessment, and it's a nice way to make a living. A lot of psychologists don't like to do assessment. They prefer to do therapy, but it's an incredibly important part of the field, and through assessment is how you figure out what is abnormal. So what we do with assessment is we have people provide information that is scorable in some way. So we're looking at scores. And typically we're comparing someone's performance on a test to their peer group. So we would look at, say, memory, and we would test your memory and then compare your results to normative data that's been collected. And let's say you're 21 years old. Well, we would compare you to the results of 1,000 other 21-year-olds to see where you fall in comparison to your peer group. And that is all statistically derived. Here's an example. This is the WAIS, the Wechsler Adult Intelligence Scale. There you'll see the psychologist there. She's reading out of the WAIS manual and administering the test there. This is what a testing situation typically looks like. The tests are almost all like paper and pencil measures. And you sit somebody down in a nice quiet room with no distractions, and you run them through a series of tests. Now, psychological assessment typically takes a long time because we use a number of different tests together for one evaluation. So scores on a number of tests are combined in the evaluation process, which yields the larger picture of that individual's functioning. So good psychological tests are reliable, valid, and they've been standardized. So I can't just go down to Professor Brophy's office and ask him to create a test of depression for me. That wouldn't work. The test needs to be reliable, meaning that you're going to get the same scores over and over and over and over again. Remember, consistency. And valid, which is accurate. So is this test measuring what it intends to measure? Is it a true measure of depression or anxiety or ADHD or whatever it is? And then standardization is standardization and administration and scoring of the test. So there's a procedure that you follow. So if I give the test, or a psychologist in Topeka, Kansas gives the test, we're administering the test or giving the test in the same fashion. We also do a lot of interviewing. In interviews, we can use unstructured interviews where we ask a lot of open-ended questions where the respondent doesn't have the ability to answer with just a one-word answer like yes or no. They have to provide you information. Now, the problem with unstructured interviews is that that same psychologist in Topeka, Kansas, they might be interested in something totally different than I am in the interview process. So the reliability and the validity of that assessment then become questionable because they might not ask the same questions that I would. But we still use interviews, and interviews are incredibly powerful tools. I like doing interviews. I can gather a tremendous amount of information in a relatively short period of time. We look at symptoms, health status, family background, life history. We'll go through more areas. We really cover a lot. And remember that biopsychosocial model, we're asking about information in all of those areas. So what's best is to do a structured interview. So the questions that you ask have been standardized, and there is a predetermined wording and order of the questions. So the guy in Topeka, Kansas and I can take the same structured interview and really get similar results. I mean, the consistency might vary a little bit, but overall the reliability and the validity should be pretty good with a structured interview. In clinical interviews, we ask questions like age or sex, why somebody was referred, what their education or work history is, their social situations. So I ask about marital status, friends, things like that, their physical and mental health history. You might not think that a psychologist would ask about medical conditions, but we always do. Medical conditions can present as psychological disorders, and psychological disorders can present as medical conditions, and both can affect each other, so it's very important. We look at treatment history, what's worked, what hasn't worked, family mental health history, family medical history, drug and alcohol use, medications, general family history, where they were born, where they live, stuff like that. And then you look at behavioral observations as well. What are their speech patterns like? Are they twitching a lot? How are they dressed? Are they dressed appropriate to the situation? Are they dirty? What do their nails look like? What does their hair look like? What do they smell like? There's all sorts of things that we look at. One thing, and this is important for you because you're going to do a mental status exam as part of your paper. So we use a mental status exam to assess appearance, attitudes, behavior, mood and affect, speech, thought processes, content of thought, perception, cognition, insight, and judgment. Now, on your paper, you're going to do a little evaluation of a television, film, book character, a fictional character, or a celebrity, and you'll do like a fake mental status evaluation. Now, I have the paperwork to do like a full mental status evaluation, but we often talk about a mini mental status exam. And you'll do this within the full mental status exam. Here we're looking at orientation to person, place, and time. So do they know like who the president is, something like that? Do they know where they are? We look at registration of memory. We look at attention and calculation skills, language skills, and then recall. All have a form. You'll do a number of these little tests. You'll see how to do it and how to score it. Most of the time in my evaluations, people get a 30 out of 30 on the mental status exam. The only problem I seem to run into is that a lot of people have trouble with this test called the serial sevens, where you subtract from 100 by sevens. Now, as an alternative procedure, you could do serial threes or have them spell the word world, like the whole wide world, backwards. But usually people get a good score on this. Some people that have brain damage or dementia or something like that, they'll come in at about a 20. So here's a short video on the mental status examination.
Now, I'm going to test your memory. Say these three words after me and then memorize them. Will you do that? Okay. Ball, flag, and tree. Say them again.
Ball, flag, and tree.
So we've just tested immediate recall, which is a test of attentional ability. So he was able to repeat them immediately. I want you to...
Okay, just a side note here. Let's say this was an Alzheimer's patient that had trouble with memory. Do you think they'd be able to do that? I always say ball, tree, car. That's the three items that I use. And if you have an Alzheimer's patient, oftentimes they can do this all day long. They're not going to have any trouble with that. But where they are going to have trouble is later on when you ask them to recall what they remember. Their immediate recall is fine. You could have an Alzheimer's patient do that all day long. But it's when you ask them to remember the things later on that you can see their deficits.
Memorize those, so keep those in mind, okay? Okay, good. Now I'd like you to start with 100 and subtract by sevens, go back by sevens, until I tell you to stop. Take your time.
Okay.
back for 5 iterations. I get a check for each of the correct answers. It's another attentional test. Can the person keep the task in mind while going back by 7s? Some defects in that one. Many people who I test can't do that. And they're otherwise normal people, and they might get 5 points off.
And I agree with him. Many of the people that I test can't do. Actually, it shocks me at how many people can't do it. You know, people with higher level education can't do that.
For that, so it's a problem with it, isn't it? Some people, it's too hard. You sometimes have to adapt this. You have to say, well, I want you to go back by 3s, depending on how much education the person might have had. I would like you to think very carefully, go slowly, and try to spell the word world backwards.
Okay. D-L-R-O-W.
Very good. Perfect. Another test of attention. This is by asking the person to do 2 things at once. Basically, keep the task in mind, picture that thing in your mind's eye, as we like to say. That's probably somewhere in the parietal occipital lobe, and then pull it out one by one. Very good. What were those 3 words that I asked you to memorize?
Ball, flag, and tree.
So he was able to keep those in mind, so that's his ability to actually recall. We tested before his ability to put them into memory, and now we know that he can bring them out.
So that's just an example of how you would conduct a mini mental status exam. Again, you'll have to do that on your paper, so I'll give you much more information on that later. Another thing that psychologists will do is intelligence testing or IQ testing. I do this all the time. Now, I know there's problems with IQ testing, and it is a little controversial. However, the tests that we have right now are the best tests that we have available to test intelligence or cognitive functioning. So what we're doing is using IQ as a measure of cognitive ability in conjunction with a number of different other things. For example, I'll test academic ability or academic achievement, and we do that in comparison to overall IQ to diagnose learning disabilities. Sometimes we do gifted evaluations. That would be typically an IQ above 130. We can use IQ score to predict future academic achievement. We can use IQ score to help us diagnose neurological and psychiatric disorders. And some organizations, specifically like the military, use intelligence tests for potential employees or service members. So one of the famous IQ tests is called the Stanford-Binet test. It was originally conceptualized by a guy named Alfred Binet in France, and he was developing a test for French school children to identify children that were in need of special education services. Instead of basing it just on teachers' opinions, he wanted to develop a standardized, reliable, and valid measure so he could determine who was in need of those specific services within the French educational system. After the Stanford-Binet, the next most famous, actually probably the most famous IQ test is created by a guy named David Wechsler. And Wechsler created a number of different IQ tests for adults and children. Here's David Wechsler right there. He taught at University of Long Island in New York. Right now we're on the WAIS 4, the Wechsler Adult Intelligence Scale, the 4th version. That's what Alfred Binet looked like. And here's the structure of the WAIS. And so you'll get a full scale IQ score, and then you'll get index scores. Those index scores are representative of different areas of functioning that were identified through factor analysis on the WAIS. So you'll have a verbal comprehension index, which measures verbal skills, perceptual reasoning index, which really measures your ability to think without using language. Working memory index is the ability to temporarily store and manipulate information in your head. And then processing speed is how quickly do you do mental computations. So those 4 indexes combine to create the full scale IQ score for the individual. And IQ scores generally range, I mean, the real range is from 50 to 150. I've never tested anybody with 150 IQ. The highest I've seen, I think, was a 137, and that was quite impressive. But in the low range, tested people whose IQs were in the 60s and 50s, and they're, you know, some of them can hold down a job and stuff like that. Other people are quite impaired. So the average IQ score is 100. Personality testing is another type of testing we do. There's 2 main forms. One is a self-report form, like the MMPI, or the Minnesota Multiphasic Personality Inventory. You probably heard of that one. Another one is called the MCMI, which is the Milan Clinical Multi-Axial Inventory. The projective tests are a little more well known. I don't use projective tests in my practice currently, but I have in the past. I use the self-report measures because I think they are more objective in their evaluation of someone's personality. So the self-report measures, we sit somebody down and they complete a test independently, and they report the extent to which the responses are accurate for them. The one that I use is true or false, so it asks questions. The first question says, like, is literally, I like mechanics magazines, and you answer true or false. Some of you may, some of you may not. Now that might not sound like it has anything to do with psychology, but that's kind of the beauty of the test, is that you can't really tell what they're asking. That's the MMPI. Now the projective tests are interesting. The projective tests want you to project aspects of your personality onto a stimulus. So you would look at something. Now there's 2 of them. One created by a guy named Henry Murray. If you're interested in his background, just Google his name. He's a pretty interesting guy. He created the Thematic Apperception test, and then the Rorschach test, which is one of the most famous psychological tests created by Herman Rorschach. Here's examples of cards from the Thematic Apperception test. What you do is you show people these cards, and the cards are stimuli which could be interpreted in different ways. So this is a card right here. Ignore her over here. So you look at the card, and basically what you do is tell me what happened here, what happened before, and what's going to happen next. And you do this over a series of cards, and a pattern might show up. So, I mean, I want you to look at this and tell me what you see here. I know what I see, but just, you know, to yourself, what do you see? What happened before this? What happens? What's going to happen next? Personally, I see a guy, and he's getting up for work, and his wife gets to sleep in, but he has to go and slave away, and it's like 5 in the morning, so he's got to drive to work next. That's my interpretation of this. Yours might be totally different. I mean, I've shown these cards to lots of clients and students, and they see radically different things. Some people see a murder scene here. Other people see like a sexual scene. Here's the next card. Right here. What happened here? What happened before? What's going to happen next? How about here? So you ask them to tell you a story, and that story will give you a theme, and those themes are indicative of that person's personality. Here's a card from the Rorschach test. Now the Rorschach test has been used for years and years and years. And actually, I mean, there's like a computer scoring program, so based on what the respondents say, you input the information into a computer, and the computer will spit out the scoring report. So it's not like you just interpret it. There's very specific interpretation rules. So here, what do you see here? Where do you see it in the card? Are you using this white space here or the black spots? Do you see color here? Is this card moving? Here's another Rorschach card. What do you see here? How about here? Usually you get lots of responses with this one. So like personally, I see two little aliens right here, and these look like blue crabs to me, and these look like seahorses, and that's about it. Maybe a caterpillar down here or something like that. So you look at all the responses for all the cards, and these are all 10 cards of the Rorschach. Unfortunately, Wikipedia published all the cards and normal responses to the Rorschach test, and it like killed the Rorschach, because you don't know if somebody has looked up, you know, what the correct answers are, and that's how they're responding. We also do behavioral assessment, where we'll look at individuals' behavior. So this is most frequently done in children, but sometimes in adults or serious mental illness populations. A good example would be ADHD. So I'll go into a school and observe a child. Typically, I want to go in before I've met the child, so the child doesn't know that I'm there to watch them, because usually they can hold it together for, you know, half an hour while I'm there. But we look at like things like getting out of the chair, disturbing other people, not paying attention to the teacher, fidgeting, blurting things out loud, stuff like that. And we can do it in vivo, like in the setting, like in a classroom, or we could try and do it in an analog setting that's similar but not the same. We can also have people do behavioral self-reports. Like, let's say somebody bites their nails. You have them create a chart for how frequently they bite their nails, and there's self-monitoring. So they could have like a little book where they keep count of how many times they engage in whatever behavior you're looking at. You can also do behavioral interviewing. Multicultural assessment is very important, and we talk about this a lot. Multicultural stuff is very important. You need to take into account a person's cultural, ethnic, and racial background, and not base things on your biased view of the world. I know most of you are in Wyoming, and it's not exactly the most diverse place on earth, but we do have other populations here. If you go to a bigger city like New York or Miami or Los Angeles, you have all sorts of different cultures within one setting, and your client population should be quite diverse. You need to take that into account. Neuropsychological assessment, that's part of my background is in neuropsych assessment. I think that's really exciting. So what we're looking at is a function of the brain, but again, we use like paper and pencil tests. So what we do is we gather information about the client's brain functioning based on performance on psychological tests. The tests measure all sorts of different things, but let's say you have a head injury or a concussion or an illness or a disease, like you have encephalitis or meningitis or dementia or a stroke, or you know, you stop breathing for 10 minutes, something like that. We use a lot of different neuropsychological tests to test different functions of different regions of the brain. So a lot of the tests measure executive functioning, and those tests really look at like the frontal lobes of the brain. Like this, for example, if you had to make a trail, this is an example of a trails test. This would be like trails A. You have to go 1, 2, 3, 4, 5. That's pretty easy, right? Most of us should be able to do that. But what if I change it up to this? And you have to go from starting here, you begin here at number 1, and then you have to alternate with letters. So you have to go 1A, 2B, 3C, 4D. Try the rest of it on your own. Pause the video, see how far you get. And a lot of people, they just cannot do this. They'll just continue on with the letters or the numbers and forget to alternate. But that's actually kind of a difficult task. It measures sequencing ability, working memory, all sorts of stuff. So you'll see this impaired in a lot of people with neurological damage. Other tests that we do, we measure construction abilities. We'll have people draw a clock. You just say, here, take this paper, draw a clock. And for example, in Alzheimer's disease, you'll see pretty radical alterations of the clock. They have something that's called construction apraxia. They can't do the clock. This would be another test. This is called the Wisconsin card sorting test. So here, a card would show up down here, and you have to pick one from up here that will go here. So which one of these up here would go here? Well, answer. Now, obviously, I can't hear you, but if you picked any of these except for 3, you'd be right. Because this one's red, so is this one. This one has 2, this one has 2, and this one is pluses, so is this. And so we start with different sets. Like the first set will be color, and you'll probably get a couple wrong until you realize, oh, color. So I pick 1, and then the card would switch, and it's blue, so you pick a blue one. So you get 10 consecutive sets of color, and then it switches without telling you. So all of a sudden color won't work, and it's going to be based on the shape. So you need to pick 4 then. But once the person learns, can they shift cognitive sets and pick a new set? That's a very, very interesting test to give. There's also neuroimaging, where we look at brain structure and brain function. So all of these look at different aspects of either what the brain physically looks like, or electrical activity of the brain, or metabolism of brain cells. And they'll give you like either graphs, like EEG is electroencephalogram, and that looks like this. We measure electrical activity of the brain, and you'll see different brain waves depending on what state somebody is in. So you might see beta waves when they're excited, or alpha waves when they're relaxed, or theta waves when they start to fall asleep. And you can see seizures there. An MRI or CAT scan machine will look like this. They work a little differently. A CAT scan is basically like a bunch of different x-rays of the brain. The MRI uses magnets to create a picture of the brain. They do a good job of looking at the structure of the brain. So if you had like a brain tumor that surgeons needed to take out, you'd want one of these because you can see exactly where it is in the brain, but they don't tell you how that impacts that individual's thinking or functioning. So those neuropsychological tests that I do oftentimes are preferable to this because we're more sensitive to damage to the brain, whereas tests like this are more specific. However, people put a lot of emphasis or importance on this. Now we can see this. This would be a CAT scan and an MRI, and we can see a lesion in the left hemisphere of the brain. But what's happening to this individual? Can you tell if this person can talk or not? You can't really tell by the pictures at all. So that's why the paper and pencil tests are still very important. Again, you see a lot of images like this. People put a lot of stock into them because they're colorful and they're pretty and things will light up. Let's say this individual was looking at like a banana or something, and scientists will say, oh, this is a banana recognition area of the brain. But what that really tells us, you know, I like the paper and pencil test because it gives us a real indication of how that individual is functioning right now in the moment. So that's it as far as assessment goes. If you have any questions, as always, ask. But I hope you learned a lot more about this in the screencast, and we'll see you in the next one.